With Dr. Victor Chow today, the principal dentist at Bamber Bridge Dental Care, and he's going to be just showing us around, telling us a little bit about what he does. So thank you for having us.
Yeah, cheers. Thank you so much, Arnold.
All right. Where to first?
So we're just come through the entrance. This is the reception area. So we're going to go down and we're going to go into the first surgery. Yeah. So in this room here, this is where our hygiene and therapist works, basically. Right. So you've got a downstairs surgery, busy list, lots of patients, and that's where we do a lot of our maintenance, basically. Yeah.
So you purchased this practice recently. How long has it been now?
So it's been about 12 months. So it's been an absolute whirlwind, and at the moment it's definitely work in progress. Yeah. So far I've tried to modernise the area. So when I first started, it was all sort of paper-based, sort of analog X-rays and things like that. Yeah. And you can see now that we've got sort of the computers in, and we've got the TVs up as well, so we can do a lot more sort of presentations, showing our X-rays, photos and things. So
I mean, we're going to see the practice, but how many surgeries have you got?
Yeah, so it's a 3-surgery practice. Yeah. It's a long-standing practice, and it's quite well known in this region. It's been here for a very long time and a very loyal patient base. Yeah. The opportunity came up and it was really exciting. So so hopefully I can just continue that sort of legacy, I suppose, and sort of improve it on the way as well.
And I guess this was the first practice that you've ever owned and run. You know, how many years had you been qualified before you thought, I'm going to
so I've been qualified for 7 years. So I've worked as a mixed practitioner and also in a private practice as well. Yeah. So I've seen a few different sort of aspects, and this practice came up. Yeah. It was a really good location. I know it. I've always lived in this area. So I'm from Preston as well. So it's nice to sort of come back to my roots, really. Yeah.
What made you think that I want to get into practice ownership? And what made you feel ready to do that?
So to begin with, I never actually wanted to own a practice. Okay. So when I first started, I thought, maybe it's a good idea. But then when I saw the ins and outs of what a principal had to do in the practice I worked at, I thought, there's so many headaches. Like constantly having to deal with things breaking, staffing issues, and sort of the day-to-day runnings. There's so much going on, as well as being a dentist. Yeah. But as time went by, I feel as though my progression started to slow. Yeah. And the practice philosophies weren't quite sort of agreeing, and I was trying to go in a different direction. Yeah. And so I thought, you know what, maybe the time's right for me to just see what I can do. Yeah. And I suppose everyone thinks they can do a slightly better job. So I thought, you know what, I need to take full ownership and I can sort of kind of control my destiny, really. So if I want to do the type of dentistry that I'm hoping to achieve, I thought I need to do that my way. So I thought, maybe let's look into practice. Yeah. So that's kind of what happened, really.
Gosh, perfect. Well, I'm looking to do a similar thing. So I'm definitely learning from Dr. Victor and finding out how he's been doing it and just learning from him. So where to next? Yeah, so
let's take you on the down the corridor. So this is the upstairs waiting area. Okay. So in here, patients are relaxing. We've got 2 surgeries, so that's primarily where the dentists work. Yeah. Let's take you through.
So, actually, I'm just looking at the decor here. Was this you or was this other staff members?
So it's a combination. So predominantly me. So since I've come in here, some of the features are still what was there originally. The table, to be fair, I probably need to refresh that at some point. Yeah. But we've put a little bit of some of my cases up there as well, just to show off some of the things.
Okay, so these are real.
These are actual cases that I've done myself. And then we've got a nice little QR code stand as well, which came recently. Nice. So that was quite nice.
Where does this take us? let's have a look.
So I can't get enough of these QR codes, so super handy since COVID. So
there we
hopefully
go.
It works.
Straight to the Instagram page. It works. It works.
So when patients are bored, they can I suppose they can check us out and see, make sure we're doing the right stuff.
Nice. Okay, where to next?
So let's go into this surgery here. So in this surgery, So in here, so we've got an ambidextrous chair, so it's quite nice.
Yeah.
So I've got all the gadgets really, just to do sort of nice work.
Yeah.
So my associate primarily works in this room. Again, we've got the TVs set up. We've got the sort of electric handpieces as well, so speed increasing. Got the sandblaster outlet in there as well.
Yeah.
So yeah, quite a nice setup.
So the last time I came just to see you at work, you were using this screen as an extra screen for your...
Oh yes, yeah.
Yeah, so do you do that most of the time with your patients?
Yeah, so always. So so I like to use both the screens. So anything that I want to show the patient, I can just bring it straight up onto it. So X-rays are on there, photos before and afters. If patients want to know what a certain type of treatment is, I can say, oh yeah, this is what I've done before. Yeah. So yeah, I think patients really like it.
I was shadowing the master himself at composite bonding, and I really like the way that you do your work. I've seen it on Instagram and I've seen it up close as well. Just want to find out how that started for you. So from foundation, being a foundation dentist, how do you find yourself doing more composite bonding and getting quite good at it?
Thank you. No, yeah, it's great to have people like yourself come in, and I think from the start I was quite keen, and I've always been quite eager, and I think I invested straight away in like loupes and a camera. So I'd recommend to any sort of young dentist out there, take lots of photos of your work and things. I think that makes a huge difference. So if you can't have that mentor there, at least you can then reevaluate your photos at a different time, show your colleagues and things, and that makes a massive difference.
It can be quite daunting though, getting a DSLR camera. I mean, how was that experience for you?
So so I just did a little bit of research online. I luckily already had a DSLR, so then I got myself a macro lens. Big shout out to people like Minesh Patel. I did that a little bit later down the line. But I'd say it's one of the biggest influences for me because it made it more enjoyable. Taking photos made it more fun, a bit more artistic and things like that. So I'd say just get any camera, as long as you've got a macro lens and a decent flash, and that should get you the good quality photos. Even if you can't, even if it's with potentially like a smartphone or something just to get the ball rolling. And I'd say make sure it's out on the table in a convenient place for you to just literally grab it and use it. Because the last thing you want to do is spend all that money and it's just sitting in a cupboard. And if it's not out there and convenient, you're always going to run out of time, and your nurse is going to be thinking what you're doing. And if you're going to rummage in the cupboard and stuff, you're just going to be running late. So even if you are running late, I'd say just get that photo, because if you don't, you're probably going to regret it. It's probably going to be your best case ever. And so yeah, always grab the before photos just in case. And then once it becomes routine, it only takes me like, I don't know, a minute or two just to get a full series, like really quickly. Snap. Got loads of retractors and things. And yeah, nowadays even my nurse can sort of do it for me. So so that's kind of the next step forward, I suppose. So
you got the camera, you're reviewing your work. How do you improve your skill set to get good with composites?
Yeah, so again, I'd say it's practice. There's so many sort of resources out there now, whether that's through sort of Instagram, Facebook. Again, I went on loads of courses. So early on, I went on courses with like Monique Versant. Really, really good. I'd highly recommend it. And then, it's just sort of having the confidence to start off with really simple cases, getting diagnostic wax-ups, trying to do everything step by step, plan it in advance. So tell us, what are some simple cases? Because I guess somebody starting out, not too sure what might be a simple type of case. So I'd say simple cases are where, generally speaking, the occlusion's class 1, you're not changing the bite or anything like that, so you're just maintaining what they've already got. And then if it's just like, everyone has to do sort of little composites on anterior teeth anyways. If you've got chips, if you've got little cavities, just start off with those. And every single case should be cosmetic case, really. I don't really distinguish what is a standard case versus cosmetic. So everything that I do, it's always cosmetic, because you're trying to get the best results. So then, when you start off, you've got, I don't know, incisal edge, stuff like that. You're doing one tooth, doing a couple of teeth. I mean, then you move on to more complex things where you've got diastemas, which are a lot harder. So you may want to avoid those at the start. So yeah, 2 or 3 surfaces, fairly straightforward. And yeah, avoid people like bruxists, anyone that's clenching or grinding. Yeah, you definitely do not want to start with those. And it's all about the patient as well. I think an easy case is completely dependent on the patient. So you might think, oh, it's a really simple filling or a few edge bonds. But if the patient is super fussy and you've not picked that out early on, you're going to really regret it once you finish, because you're just going to be back every single week with a little chip, the angle's off, and then just going to be your absolute nightmare, and that could put you off. And to be fair, very early on, I did do a case like that, and it did really put me off for quite a while. And so I think it was 4 teeth, it looked fairly straightforward, got my diagnostic wax up, started it, and then I thought it was okay and the result was decent, but the patient wasn't happy. It was a big improvement and she agreed, but there was a few minor details that could have been improved. So I had to do a few retries. I think literally I must have worked 2 days before Christmas to sort something out. But then it worked, it was absolutely fine. So I think it took me an extra 2 appointments until she was really happy. But it taught me so much, to be fair. So it taught me, well, all the polishing protocols and then looking at all the different angles. And back then I probably didn't appreciate what she was talking about. I knew something was off, but I didn't really understand exactly why. But now with like more experience, like sort of 5-6 years on since I did that case, like I think I picked up so many more tips and tricks. I can know where to look and the line angles and sort of making sure you're looking at sort of 3D space, so like from the front, from the sides, kind of almost underneath as well.
But I get you don't get to this point without first going through all those cases in the beginning.
Oh yeah, I mean, there's been loads of, I've learned so much, like, and almost every case I look now, I'm still never like 100% happy. There's always bits that I'm trying to improve. And a lot of it is just, finding people to speak to and sort of, experimenting. I've changed the way I've done things so many times. I've kind of just mixed a bit of everything that I've learned over the years.
Show us some of your equipment that you like to use in.
Okay,
when it comes to cases.
So I'm going to have to run next door because actually this is the associate's room.
So we can go next door together.
Let me show you some of the stuff. So I did a few composite cases today actually. So this is a very small decon area. So this is my surgery. So in terms of equipment and things, so this is the room that I work in. So I've always got my loops, I depend on those. So again, I'd say that's super important. Even if you don't have the right stuff, I think having magnification makes such a big difference. So if you can't see it, then it's just impossible to get a really good result. So
what magnification did you start on?
So I started on 3.5, so I'm now on 5. And it's the lights, the light's super important. So get those as early as you can. I think you'll get used to it and it'll just save your neck and your back and things. So in terms of my composite instruments, so routine, I kind of used sort of the LM instruments. So these are pretty handy. It's got what it needs. You've got your burnisher, it's got a really thin flat plastic and that's super important. Otherwise, if you have your standard sort of metal ones, I really struggle to get into the contact points. So this is the LM stuff. So this is your standard sort of burnisher, which is quite handy. It's got a thin flat plastic in there, which is quite useful. So this is sort of my everyday fillings. And then I use this, which is the Fissura, which is really, really good. It's super sharp and it's very fine, so you can get into the fissures and things if you're doing particularly a posterior work, or if you want to do mamelons and things for front teeth. These are really handy. I'll be honest, I don't really use these that much. So you've got a scaler, which is handy, but this one I don't really use, which you can measure different spaces for dentines and things, and enamel. For my composites, this is the kit I actually use. This is all I really need. To be fair, this instrument is so handy, which is the Sculpt and by Ivoclar. Really like it. My preference is the 6mm pad. I've tried the 4mm, but for me, the 6 one, it's just a bit easier.
Just explain what that looks like a little bit.
Yeah, so the pads, so basically they come like this. So this is some of my composite bonding kit. So yeah, a few different composites that we use, and then a few Softflex, which I rely on. So in here, you've got the Sculpt pads, which are really, really handy. So if I get one of these out here, okay, great. So for this, you place it on, and it looks a bit like this. So it's like a wide paddle. It makes it a lot easier to blend the composite in, and I find that I'm treating a larger surface area. So if I am doing sort of composite veneers or edge bonding on front teeth, I just find it just blends in really, really nicely. It's not sticky and things like that. So yeah, highly recommend that. It's not too expensive, and yeah, it lasts ages, so really, really good.
So you were the first person I saw using that. I've now got
really?
one.
Have you got one?
Yeah, I got one now. Love it.
Yeah,
Love
so I've tried all sorts, to be fair. I've tried the clay sculptors, I tried the brushes, which can be good. I've tried the, I don't know, the Hobbycraft paint brushes, terrible. So I've started off with everything, especially as an associate, just experimenting with the cheaper stuff. But now, to be honest, I just recommend just go for the proper stuff, because you just build it into your prices, and it just makes your life a lot easier.
Yeah. I agree.
My next main instrument that I'd highly recommend is the IPCL. So yeah, really, really useful. It's super thin. Again, you can really get into those really fine sort of contact point areas. It makes a huge difference when you're trying to get in there. And yeah, so these are my go-to for composite bonding, really. That's what I like to use. The other instrument that you see in here, which I don't actually use that much, so I've tried it. Again, it's quite nice. It's the Elmore instrument, the gold one, and again, it's got a really wide sort of paddle area, so you can place the composites quicker, and it just gets a better plane. But I've got so used to this that I just rely on this. Yeah, so I think some people probably juggle between the two. But yeah, I've got used to this, so this is my instrument of choice.
Perfect, thank you for that. Where to next?
So let's take you downstairs. So we're going to go across, back through the waiting area. So this is pretty much an office at the moment, but we're also hoping to use it as more of a TCO space, so we can get some nice before and after photos. My team can also talk to our patients, sort of going through the consent process, finances, things like that as well. So it's quite a nice space for my team.
Perfect.
It's got the computers as well, if we need to do anything. It's got the webcam up there as well. So yeah.
The thing is, in most practices, what you just have is the waiting room, then you're straight into the surgery. So it's nice that you've got designated spaces for these other things as well. Yeah,
so I think, it gives you more space, basically, because we've only got 3 surgeries. So, I don't know, those times are kind of limited. Yeah. So this gives us that extra space just to sort of improve the customer or like the patient experience as well. So yeah, it's quite nice.
Perfect. Any other rooms?
So yeah, the very last one. So yeah, let's take you back around. So the last part, so just looping around. So most of the patients wouldn't actually come through this part here. So this is the downstairs waiting area.
Yeah.
So a lot of patients will come in here, they'll fill out any forms if they need before we take them upstairs.
Okay. And then you'll have, what would usually be playing?
Oh, so honest, so this is just the TV actually, yeah, it's just patient entertainment, so yeah, it's just transcribes like BBC News or something, so yeah, nothing too exciting, daytime TV.
Yeah, no, thanks for that.
Yeah.
Thanks for showing us around.
Yeah, no, cool.